Congress failed to repeal and replace the Affordable Care Act again and again and almost again, but that doesn't mean that it's not being weakened. The Trump administration can still do plenty to mess with the law. We warned about that in many episodes, and it's coming to pass. This is Healthcare Triage News. A report released this week by the Urban Institute looked at the potential impact of the short-term limited duration policies that might be possible soon under proposed HHS regulations. Such plans, which would be sold to individuals and families, would not have to comply with ACA regulations. What regulations, you ask? Well, the ones that mandate no annual or lifetime limits, for instance. Right now, your insurance can't run out over a year or even over a life, no matter how sick you get. That's a good thing. But new plans might not need to do that. Also stripped away are the essential health benefits that everyone has come to expect will be covered. New plans can be much more bare bones, like no mental health coverage, for instance. Oh, and that pesky guaranteed issue and community ratings thing could go. That means you can be charged much more if you're sick or refuse to plan at all. Basically, it could be as if the ACA never happened. How did we get here? Well, short-term plans, as these are called, are loosely regulated and are really only supposed to cover you for no more than like 3 months. Like if you were moving or knew there'd be a short gap between jobs. You know you'll buy other real insurance and just need some basic protection for a bit. In an ideal world, these would go away entirely and people would never be uninsured. But under the ACA, these would at least be gotten for only 3 months or less. But under Trump administration proposed rules, these plans could last up to 364 days. That will make many more people consider them each year. Why is this important? Well, clearly they're more attractive to younger, healthier people. If they get siphoned off from the exchanges, then there's the whole adverse selection thing, where sicker, older people are left. Premiums go up, more healthy people leave, which leaves sicker people. Premiums go up, more healthy people leave. Repeat ad nauseum. We also got rid of the individual mandates starting next year. That's gonna compound the problem. Added together, the Urban Institute estimates that this will lead to an estimated 6.5 million people being uninsured in 2019 and another 2.5 million being seriously underinsured compared to what we'd have by not doing any of this stuff. But there's more. In addition to all these people being uninsured or underinsured, premiums for everyone buying real insurance will go up. How much? An estimated more than 18% in the 43 states that don't really restrict short-term plans. But there's more! Because of this, federal spending will go up an estimated more than 9% because we have to subsidize people buying the much more expensive plans. So, to recap, many more people uninsured, many more people underinsured, those that still have insurance pay more for it, and the federal government pays a lot more too. So, what's the gain here? Freedom? I don't know. We like to make videos about stuff that sometimes YouTube doesn't like to sell to advertisers, and that's okay, because we care more about content than we do about ad revenue. That being said, there are ways you could help support the show to keep it going, even without that kind of ad revenue. And a good way is through a subscription service called patreon.com, which allows you, the user, to help support the show in any way you can. Go to patreon.com/healthcaretriage, give as little as $1 a month, everything helps. We'd especially like to thank our research associates, Crafty Geek, Joe Sevitz, Carlos Iergos, and our Surgeon Admiral Sam. And while I've got you, think about going to hctmerch.com and picking up some great merch, including lunch boxes, mugs, posters, all kinds of good stuff. And my book, The Bad Food Bible, still on sale anywhere books are sold. I'd appreciate it if you pick up a copy.